You, I know you're. Good afternoon, everyone. Welcome to the Jersey County Health Department Board of Trustees meeting for April 24th, 2025. It is about 4:02. If everyone in the audience would please mute or turn your phones off so we don't have any interruptions as we move forward with our meeting. I will now call this meeting in order. Roll call, Ms. Pinkley.
Mr. Pig,
I am here.
Dr. Henry,
Here.
Ms. Stidham,
Here.
Mr. Deal,
Here.
Ms. Taylor. Here.
Quorum has been established. Dr. Henry, would you please read the mission, vision, and purpose?
Sure. The mission, promote positive health outcomes through delivery of foundational public health services. Our vision is a healthy Jefferson County. And the purpose of the health center, JCHD, is established, maintained, and operated for the improvement of health of all inhabitants of Jefferson County.
Thank you very much. So I have the agenda in front of everybody. I'm looking for an approval of the agenda as presented. I know there's an amendment that we're gonna make. I'll make that.
I move to approve the,
Oh, I need to make an amendment if somebody, and if you want to do it, you want me to, I'll do it too. I'm gonna move that we remove the approval of the March 27, 2025 meeting minutes until the next meeting.
I'll second.
Having a first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye. Aye. Any opposed? Motion carries. And now we need approval for the amended agenda, please.
Make a motion to approve the amended agenda.
Do I have a second?
second,
Having a first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye. Aye.
Aye.
Any opposed? Motion carries. Welcome to guests. I know we have several today. So welcome to the meeting. We'll get to you down in section 7. The next on the agenda will be approval of the March 2025 expenditures, and that is for $92,430.86.
Make the motion, we approve the March 2025 expenditures.
And first, do I have a second, please?
second,
Having a first and second, is there any discussion on the matter?
I did have a question, but it also pertains to the credit card receipts as well. For the nacho conference. The people that we paid to go to the conference doesn't match the air flights. So did people drive down?
Kristen,
For the flights, you're asking about that.
They were the one that was in Texas.
Yeah, they, some of them are charged at different times.
Oh, okay, so we should see those on the next.
They might be in the previous one.
Yeah, we had.
Get the early bird special.
Okay.
Then put names in, so we've adjusted that.
Okay, thank you.
Any other questions? Not hearing you, all in favor, please say aye. Aye.
Aye.
Any opposed? Motion carries. Next is the approval of the March 2025 electronic payments for $464,596.74. Do I have a motion for approval?
I make the motion to approve.
Have a second?
I second it.
Having a first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye. Aye. Any opposed? Motion carries. And I believe this one, there was a scribbler's error on this one in the document that actually went out. I know this one's corrected on mine. I guess since the update, it said May 24, didn't it? Or what was the,
It's
what was the scribbler's
April.
error? April, okay.
It's for me.
So
There
it's
was
for
April,
May, so
May.
it may be, it's different, so it's the scribblers there, it is for actually May, so. This will be for the pre-approval of the May 2025 electronic payments, the amount of $677,000, excuse me, $677,550, no change. Do I have a motion, please?
I make a motion that we approve the pre-approval for electronic payments.
I'll second.
First and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye. Any opposed? Motion carries. That brings us to the director's report. Mr. Sykes, the floor is yours, sir.
Okay, I'll just quickly go through some of these, the grants and contracts. As you know, a lot of these got put on a pause and some were terminated. We did receive word that the NEHA FDA flexible funding model, that grant did come through, although it was cut. The original requested was 262,647. They actually are going to fund us 51,500. So quite a significant decrease, but yet better than zero. Still no word on Title 10 funding. That's been put on hold and really don't know when we'll hear anything on that. I'll skip on down. We did, after I already put the report out, Mr. Ferry, our IT manager, received an email that the suspension was lifted from the cybersecurity grant, so that we will receive that money. I think some more information will come out about how it will work, but that we're using a lot of that for some infrastructure improvements. And then the last three are the ones that were terminated. I think I talked about that at last board meeting. So, wanted to let you all know that we did do 100% completion on our cybersecurity training, so thank you to the board on that. And another thing that came through, and Steve's here, that training got changed. It'll come out on the first of each month now.
Yes, CMIT, our managed service provider, wanted to clean up some of their reporting on their end, so they're making all their clients effective the first, so we won't get another one until May 1st.
So be looking, May 1st, you'll be getting another cyber security training. Number 3, Christie sent an email back in March, informing us that they need to increase their rates. And it is in accordance to the contract that we have with Christie's firm. It will go from the contract, the engagement letter we have, $285 an hour. And it'll go up to $300 an hour. And in the fees segment of our engagement letter, it does say they have the right to adjust 7 to 10% annually. I don't think we've had an adjustment since
Since I came on in September 2020.
and this falls falls below that 7%, I believe, even so. And she did give us a 30-day, she sent me an email within the 30-day requirement. This would be effective May 1st of 2025. I talked a little bit to Tim about this, that since it falls within the engagement letter, we're gonna go ahead and move forward with that rate unless someone feels differently about that. Got an acknowledgement. I think I spoke on this a while back, but she got sworn in. Jetty is now officially on the Jefferson County Public Safety Commission. She got a little certificate and everything for being on that, or she's our representative on that Public Safety Commission. Also, you'll see this in the Clinical Services Manager's report. We do have our new mobile health center. And I don't think it's on the parking lot right now. Is
It
it?
may be before the end of the meeting.
It is already out in the community being used, but if it's here after the board meeting, get with Melissa. And if you wanna go take a quick look at it, it's parked right out the side door. You shouldn't miss it if it's parked there. But please take a look at it. They really like it. I think they're enjoying it. I wanted to add one more thing for the board members to be looking at. We will be emailing the policy and procedure changes for you all to review. And if you want to make comments on that, please do. We'll try to get that ready for approval at our next board meeting. The Jetty's we're gonna put it into a bullet point of the changes that we made. It has been reviewed by Amber and Dennis, and Christie has looked at it as well. And so we'll send it to the full board for your review, and then we'll vote hopefully at the next board meeting. So be looking at that.
Amber, just, that's the personnel committee.
Personnel committee. Yes, sorry about that.
Correct.
So that's all I have for my report.
Okay. I think Melissa probably is next, correct? Dental reference to the dental program direction.
Good afternoon. How are you all today? You have the clinical services report in your packet, so if you have any questions, let me know. You'll see a couple pictures of the van in there, like Steve said, and how excited we were whenever we received the van and did training with Craftsman. That came in March 31st, and we had the van out there in the community the very next week, so really excited. It's really nice, and we are able to provide a wide range of services through that new vehicle. Okay. So the main topic I want to talk about is the direction of our dental program. You guys remember Brandon as our dental supervisor. She was here talking before. I gave you an S-bar in your packet, so there's a lot of information there. Basically, we have in the past had two programs under the dental umbrella. One has focused on pediatrics and one has focused on adults. They've come on at different times. We've had the pediatric program since 2005. It's gone through various changes, but we've consistently been able to provide school-based services for dental care since 2005. The adult dental care was brought on with a new van in 2016. And its primary focus at that time was for seniors. And COVID kind of hit us with some changes there. And we've had to kind of regroup for a couple of different reasons. One, the model looks different now than it did 5 years ago. What's acceptable, what we've also had some experience with the van itself. And some of the complications associated with moving such a large van in Jefferson County with a special license that requires CDL to transport it. Our kids' van does not, just requires some internal training. So we've run into a few barriers and a few things with moving that van around the county. It has actually been behind Arnold for the last couple of years primarily. And we have expanded it to adults, not just seniors, all adults. And we've done a variety of different things to try and balance and be able to see both pediatrics and adults. Brandon's team has done an excellent job of trying to balance those two. We have limited staffing now. Our staffing model looks very different than it did back in 2018 for dental. And recruiting for those professional positions looks very different now than it did back in 2018. We have one dentist, two hygienists, a dental assistant, a front desk, and biller. So we've combined those two positions and Brandon as our supervisor. They've been trying to rotate back and forth between balancing those two programs, and it's been extremely challenging. Not only that, it is very costly to continue to do maintenance and repairs of two vans. There's been some changes in the community, as you may be aware. Compass is getting ready to open up a new dental clinic in Festus. They opened one in Arnold, so availability for dental services has changed in the community. We're looking at trying to focus more going forward on our pediatric population. So that's what you have in your packet here that describes just a change in direction. It's not that we can never see adults, but just adjusting the model, the operational model a little bit so that we can primarily focus on taking out that pediatric van. That is a lot easier to use in the community and is more flexible. And trying to expand those services, because we know that we're getting more interest in that as well. We do several schools, and this year we also had different schools reach out to us and want to add to our schedule, but we have a lot of limitations. So our proposal is that we focus on primarily pediatrics. We can still see adults on the van, the one van. We would like to try and sell the adult van and then take that funding and put it back into the dental program. You can see from the budget here that the largest portion of our dental program, 62% is funded through mill tax. So that could help some of that and free up how we're using that funding. Questions?
I know that the adult van traveled to nursing homes and where older adults can't necessarily get transportation. So does Compass help provide that type of service or?
Not that I'm aware of. A lot of the nursing homes won't let us come in anymore since COVID.
Okay,
So that's been a big obstacle too, is why we aren't taking the van out as often.
gotcha.
Some of them actually bring folks to us or bring them to other dental offices, so they will take their patients out. Whenever we were visiting some of those places, it was really challenging to get that large van in a place that was going to even be safe to see those folks right there on that parking lot. So I know Mr. Sykes has navigated that van in a lot of different, very challenging locations.
Well, if they can be seen on the pediatric, if they request, if there's a nursing home where they request, can you take it? Would you be taking it out to help with that?
I don't know if we would have the capacity. What do you think?
At this point, I don't think so. Right now, so with being in the school program, we're booked from September to May. So really it's like those summer months whenever we're looking to maybe have some open clinic days where we see adults those days or emergency clinics those days. Being a clinic, you have to be able to be a general clinic, you have to be able to be available at all times for your clients. So unfortunately, we're not able to as much with having the schools. So focusing more primarily on like emergency situations would be, for adults would be where our focus would be in that aspect. I mean, and now if a nursing home calls and they have an emergency patient that we're able to see, then as long as, they're able to get into the van at this point, I don't see a reason why we couldn't see them. There's nothing that's holding that back.
Gotcha.
I think from me being in dentistry for a number of years, adult dentistry is hard. It's very challenging and very expensive. A lot more expensive than seeing pediatric patients. Because you're looking at years of neglect, possibly dentures, the cost of that. So how would you, I don't know what the cost of that, how would you navigate that, with the money that you have available? And how would that work?
Ask that again. I'm sorry, I may not understand the question.
Because it's expensive. So would you pay all the costs of dentures, impressions, and
So what,
all of
how
that an adult would need?
how we've been doing it is a combination of things. Most insurances, as you're aware, aren't gonna cover dentures. we work with the laboratory and there are some clients, if they don't have availability, if they can't pay out of pocket, then we do have grant funding that has helped that in the past. We've kind of been in a losing situation with that, to be honest with
Going
you.
forward, where you have that grant money available, you don't know.
So we will, but the focus would primarily just be on pediatrics and those emergency cases, as Brandon said. Well, we currently have funding available. I don't know that we will have grant funding after May 31st. We have not heard yet.
I kind of agree with that model, same pediatric and then working in adults on an emergency basis whenever you can, and working with nursing homes whenever you can. It's not easy. Especially with all the infectious diseases and stuff that you're gonna.
So if we can't provide services, who do we refer to folks or what are their options?
Right now, we're currently referring most of our patients, because we're not taking on new patients right now. And so those patients we're referring to Compass. We've got a few other options, like there's the Elks Dental van, the Archdiocese has a van. So there's other options that we try to, provide the community with.
What's Compass doing? I mean, do they have,
So the facility that used to be Save-A-Lot in Festus, they're opening that facility, and remind me how many operatories they'll have for dental?
16.
16 operatories for dental. They're gonna have pediatric specialties. They're gonna be able to do oral surgery, a lot more capacity than we can do on the van. Other questions?
Where do we stand on fluoride and treatment?
That's not us. We don't put fluoride in water, so
Well, we
that's.
do it in treatments, dental treatments.
So, I mean, all parents and all patients have the option to refuse fluoride at any time. It is an option. It's not something that we make them utilize.
So if it comes down that the fluoride then is taken out of the water used in dentistry, then we would remove that from the program.
We would follow those ADA guidelines for dentistry.
Thank you.
Any other questions? Okay, thank you very much, Melissa.
Okay.
We don't need to vote on the proposal right now.
No, you don't have an action item on your agenda. If you wanted to formally act before the approval, would have to wait.
So next is Christine, the comptroller's gonna tell us what she's gonna do with the money.
Well, Jenny and I met with our bank representatives last week to go over our bank accounts. And we want to we're going to put in place some much needed efficiencies and protections. Efficiency wide, we want to change our method of payment from manual checks and then going on to every vendor site that we pay electronically. We want to change that to ACH. That's gonna save us. It's gonna save us money. It costs us about $1.58 per check. We ran about 777 last year, so that was about $1,225 just spent on mailing out checks. With the ACH, there is a monthly module cost of $60, and then it's 20 cents per transaction. But if I base that on the cost of 777 checks, the cost is $875. So we save about $350 a year doing that. We will have reports for the board for pre-approvals before we make ACH payments. So,
assume we do any checks?
well, we'll have to do checks for people who don't want to do ACH, can't force people to let us do that, so it'll be minimal. But it should save us time as well. So the cost of the per check didn't include the time of my staff. And it takes almost a whole day, I think, sometimes to go to every vendor site to do those electronic payments. It's kind of time consuming. So that is that part of it. We also talked about additional protections for our bank accounts. We will be adding, they call that positive pay. We're adding positive pay, which basically is we present to the bank whenever we're issuing payments, what those payments are. And if somebody comes and sends a check to them or a payment to them that wasn't part of our report, they will send us Email, right? Yes, they'll send us email and text messages and all that, and we have until 2 p.m. that business day to say, yes, that's good, or no, that's not. And that's just will really help with the increase, not on our accounts, but all the bank accounts in America, their fraudulent activities that have been happening. And we're also switching to they suggested that we switch to a nightly sweep of our bank accounts. It's going to increase our interest rate and still be FDIC insured, and we will continue to be in compliance with our funding sources. The bank estimates it's an approximate 50% increase of our interest earnings on our checking account. So like in March, we had about a $4,000 interest. I think that would be about 8,000 or 9,000 if we had been using the sweep. Or any questions?
When we sign these checks, we get the invoices, so we can look through to see what payment we still get. Like the invoices with the check, or when we have it to the board to approve it,
It'll be a different report.
will we still get to see like what was actually sent to us? We can see where the money.
So we can do something of that. Maybe we need to have a finance committee meeting to just kind of go through what the board wants to see and how we can best present it.
Your Honor.
Oh, and it's gonna save you guys time too. You won't have to sign all those checks. Say that. Anything else?
Thank you. Next on the agenda is public comments. Reed, you have the cards. You get public comments. Did you get the cards, signing cards? So while Bree's doing that, I'm going to make sure, please ask that everybody speaking, please don't have any personal attacks and be civil with your comments. Appreciate that. Thank you.
The first person on the list is Alan Liederbrand.
It's 5 minutes. You're gonna take 5 minutes, right?
I don't think so, but
Go ahead.
my name's Alan Liederbrand. I live at 5062 Romaine Spring Drive in Benton portion of Jefferson County. I want to thank you for the opportunity to speak. I was at your last board meeting in March, and there was a discussion about the measles vaccine. But when I went back to look, I had wanted to refresh my memory on that. So when I went out to the audio visual, when we got through Director Susan's speech, every sound went dead. Couldn't hear, and the camera just ended up being on Director Pig's face the whole time.
That's bad.
So then I went to the minutes, and there was no discussion. It wasn't even in the minutes for that meeting. So I'm kind of concerned that if you're totally relying on the video and the video fails, the public has no way to find out what's really been happening at the board meeting. So I think, things need to be put in the minutes just because of technical difficulties. And I know there's a big, the county's pushing here, and I've seen on Facebook, or at least some stuff's come on my feed about getting vaccinated for the measles. Unfortunately, I know there's people are but concerned about getting vaccinated. And I think it's all had to do with COVID. The CDC screwed it up big time. They told you masks didn't work, then they told you they did. Find out now after peer reviewed, they don't work. The same way about the 6 foot apart. That was just to make people feel better. Same way with the shots. Unfortunately, I have more friends died from taking the COVID vaccine than died from it. So with complications, they had their blood just coagulated, killed them. All of a sudden they had cancer that went from being in remission to stage 4 within a month, dying. A lot of people. So there's a lot of apprehension about people taking vaccines, especially when the government's pushing it, and the government's lost their credibility. So I just encourage you, make sure you do get actual independent peer reviewed studies before you push anything. Because I think it's up to the people you can inform them, but leave it up to the people to make the decision whether they take it. Thank you for your time.
Thank you, sir. All right.
Thank
No, no, just, we'll go to the next one. We don't get into the question answers. Who's the next, please?
Lori, I'm gonna mess it up, Bourgeois, okay, sorry. Hi there, my name is Lori Bourgeois. I live at 7877 Riverview Road, in Denver, Missouri, 63023. So I'm coming here as a RN of 33 years. I'm kind of piggybacking, I guess, on what Alan said. I guess my question is, you know, we have this measles outbreak and a lot of information out there. What I want to know as a nurse is, are we providing true informed consent to the public? Are package inserts offered or awareness to the VAERS monitoring system mentioned to parents? Offering risk versus benefits is what provides true informed consent. Safe and effective is not good enough. So how can we say safe and effective when a package insert, section 6, lists adverse reactions mentioning everything from atypical measles to encephalitis or pneumonia? These reactions include those identified during clinical trials or reported during post-approval of the MMR vaccine and its individual components. Specifically in section 8.4 for pediatric use, the MMR vaccine is not approved for individuals less than 12 months of age. Safety and effectiveness of measles vaccines in infants below the age of 6 months has not been established. If we move down to section 13.1, it mentions that MMR vaccine has not been evaluated for carcinogenic or mutagenic potential or impairment of fertility. We cannot simply say that there is no risk. Therefore, there must be a choice and there must be informed consent. Why are we not focusing on educating the public on healthy nutrition? We need to help people to understand they have the ability to support their immune system naturally to help them when invaders do come into their space. Also, we need for medical institutions to offer proper treatments. I feel medicine is losing its way. We have become nothing but protocols created by bureaucrats. There is no thinking outside the box allowed. We've seen this with physicians such as Dr. Pierre Corey, who has taken the time to review the medical records of 2 young girls who died recently in Texas. Something as simple as prescribing the wrong antibiotic as well as not implementing treatment quickly appears to have led to the demise of 2 young children. Dr. Pierre Corey is a pulmonary and critical care specialist who has researched and managed lung failure his entire career. When are we going to get back to debate and discussion of conflicting ideas? Instead, we just shut people up and censor them, which I believe has happened to one of our board members who has a long career of caring for patients. My question is as the science and data is shared, as we have new leadership in Washington, will you still consider the CDC your gold standard, or will you find a reason to go rogue? Once again, my goal with speaking up is always to make sure we're providing informed consent. We should be providing the information as well as letting people know where they can go and review a package insert and decide what is best for themselves and their families. Thank you.
Thank you very much for your comment. Let me see if I can fix this. Okay.
Next is Liz Downer.
Hello.
Thank you.
Today, let's have a conversation. I have questions to ask, but you cannot answer. So ask the questions and answer for you. Me, I have a list of ingredients to share with you. I'm wondering how these ingredients are categorized in your mind. Are they benign or poisonous? Formaldehyde, polysorbate 80, mercury, aluminum, phenyl oxyethanol, potassium phosphate, sodium phosphate, sorbitol, monosodium glutamate. You may answer, well, that's quite a list, but I'd easily have to say that they're all toxic to humans, used in fertilizers, pesticides, to stop the heart, to preserve a dead body. They're registered in different categories, but pretty much poisonous. Why do you ask? Me, if I were to deliberately feed or inject my child with these ingredients often as a schedule, obviously I'd put my child in harm's way. but what would legally happen to me? You may answer, odd question, but you're likely to be charged with criminal negligence, perhaps with intent to kill, and of course, child abuse. Your child would be taken away from you. Do you know someone who's doing this to their child? This is criminal. Me, an industry. These are ingredients used in vaccines with binding agents to make sure the body won't flush these out to keep the antibody levels up indefinitely. You may be beside yourself. You may ask me if I could email you all of this information. You may want to share this with your adult children who are themselves parents. You may be horrified and feel awful that you didn't know. Your children have been vaccinated and they are having health issues. Why, when the HHS director of the United States has made notice of researching and collecting data on causes of the rise of autism in children, and very high in boys especially, 1 out of 12 boys in California is diagnosed with autism, would a health department whose vision is a healthy Jefferson County, and the mission is to promote positive health, why would you promote a toxic and poisonous injection into humans for a disease that is treatable with immune boosting supplements? Vitamin A and C are both heavily documented by peer-reviewed reports to combat infections. We need to stop poisoning our children, our adults, the food, our soil, our water, our air. We need to stop poisoning our minds with propaganda that is brainwashing humans. Critically think about what your role as a health department is. Are you in it to heal people or to make people sick? When you stick a needle into a human's arm, you are injecting toxins of formaldehyde, carcinogens, multiple aluminums, thimerosal, which is mercury, polysorbate 80 and 20, fetal bovine serum, foreign DNA, and multiple other toxins that may cause damage to the liver, the heart, the central nervous system, the brain, the kidneys. The entire human body is filled with toxins from these ingredients in these needles. Jefferson County Health Department, this question is for you. Do you really want that on your hands as a healthcare provider whose vision is a healthy county? Parents, this question is for you. Would you say yes to a doctor if they said, today we'll be injecting formaldehyde, aluminum, MSG, aborted fetal DNA fragments, fetal bovine serum, monkey kidney cells, mercury, and pig circoviruses into your tiny baby? And I have some provided documents to your hands to support my statements.
If you want to give those documents to Breanne, she'll give them to us later. Thank you.
Next on the agenda is Wanda Honeywell.
Hello, I'm Wanda Honeywell. I live at 1045 Benner Grove Drive in House Springs. And I have just a really simple question. And it's regarding the new building. Will there be a location in the new building where taxpayers that we can go and view historical documents of the Jefferson County Health Board?
Plenty of rooms there, but we'll answer that later.
What's that? I'm
We
sorry.
will answer that later. We can't really have a discussion at this point, but we'll understand your
Okay,
question.
thank you.
Okay. Is there anybody else?
Yes. Alex
Oh, okay.
Corvette.
You got it right.
Did I?
That's very good. A lot of people like to add an H to it, or
Well,
something.
penmanship.
It's not even there, That's, a lot of people are into that thing. Thank you so much for giving me the opportunity. My name is Alex Horvat, and I'm keeping with the, what everybody else is doing. I'll give you my address, I guess, to 7302 Old Highway 21 or Old State Route 21. That's in lovely Barnhart, Missouri. I'm sure all of you are familiar with how lovely Barnhart is. You can find it. So anyway, I'm here today to stand for three things. First, reality, not manufactured reality. If you go through history, I'm a big student of history. I've got a background in media and journalism. I won't go into that here, but nonetheless, I've seen how it's being manufactured largely. And during the COVID crisis, we had nothing but manufactured reality. So that created some problems that we're now kind of slowly as a body of people waking up while there were a lot of other people that were waving the red flags and saying, hey, you can't do that. I'm only a small fish in this stream, swimming against a huge tide of corporate and political interests. However, these influences manifest in your world too, and I'm sure that many people can be intimidated into submission. I'm just here to support those people, that those voices that need to be heard now, because whatever we experienced in COVID, the plan is, at least if you read the tea leaves in between them, more's coming soon. Okay, and it's gonna be the same round, it's gonna be worse. And who knows what they're gonna be pulling off here. My appearance here today is not as any kind of theorist. I don't need theories. If I do kind of expound on certain things without facts, I would definitely let you know that. But the very source of these COVID injections is a source that we know, and we've heard the name over and over again. And there's other pharmaceutical companies involved too. The reason I came here tonight or today is to share with you some of the leads that I have followed that have led me into a much more enlightened path. And I really appreciate the people before me, Alan and the other Alan and Elizabeth and Lori. I mean, they're all on the right track, but I just want to bring this into a new shed of reality. And if you'd like, I'll even read you some of the things that they've discovered. But some time ago, September of 2023 to be exact, I had heard that a group of people, it was March of 2022 when I first heard this gal speak at Hillsdale College. And her name's Naomi Wolf. I don't know if you've heard of her, but she was a huge, big feminist back in the day, nationally, publicly. Then she went astray from the viewpoints that they prefer. And then they said, well, we can't have you anymore. So she got bumped off the media pretty good. Nonetheless, Naomi, for reasons that affected primarily women, got involved in this whole COVID thing. And what she found out is that Pfizer, because of the Emergency Usage Act, did not have to disclose the contents of the vaccines. They did not have to disclose the testing that they had done that indicated the safety, the effective and safe. They didn't have to disclose anything. And so that we were left with something that we really didn't know what we were doing. We were just, again, manufactured reality. But what happened is that they reacted upon a group of attorneys that sued Pfizer. And they sued Pfizer to get that information because legally they were supposed to release it. The judge that was involved in the court case was told by Pfizer, listen, judge, please. We don't want you to release this for 75 years. Okay? And that if for JFK fans here, that's the same thing they did with JFK. Nonetheless, they did, the judge, a fair-minded judge said, no, we're gonna release it now. And so he did authorize the releasing of the data. He went in favor of that decision. This data was so overwhelming when they finally released it, and that Naomi Wolf was one of the person, the other one was Amy Kelly, and both of them decided to go ahead and tackle this data. Well, this is kind of like removing Mount Everest stone by stone, because the data they released was over 455,000 documents. 50,000 documents a month. By the way, a document is not a single sheet of paper. In one case, in the book that they came out with, it was 99 pages. So if you want to talk about number of pages, I have no earthly idea. It's just a whole lot. Okay. And they eventually came out about a month late, but they did come out with it. I just wonder if all of you are familiar with this book. This is not a conspiracy theory. This is what Pfizer says about these injections, vaccinations, and all this kind of stuff, which I know that you know.
Your time's up, sir.
Oh, it is?
Yeah, you have 5 minutes.
Oh, really? Okay.
Thank you.
Okay,
If there's
well,
any-
then you're not
if
gonna
there's
hear
any
anything from the
document-
book.
if there's any
I just
document-
hope that you get it and read the dang thing.
There's great documentation.
Okay.
This will be more than.
Well, I'm not gonna be leaving
No,
the book.
I understand.
But you can get it and you can find out yourself what you missed.
Thank you very much.
And it's from Pfizer.
Is there anybody? Okay, thank you very much. Old business, new building updates.
Okay.
Steve, you guys go.
Yeah. So where we're at right now is we did a punch list. That's where we walked through the building and see things that we felt needed to be corrected. They didn't, cracks and shit wasn't there or whatever. So that's been completed. The architect brought some engineers and stuff as well, and they walked through. We had a significant list that we gave to the contractor. That's where they're at now, working on correcting those punch list issues. Where the furniture is ordered, there's been a delay with some of the furniture. Some of the stuff is not in stock, so we don't know for sure if it's ever gonna arrive, so we may have to change, and that's not a big issue with, it was a few of the chairs for the conference room. But as of now, the furniture is scheduled to be installed beginning May 13th. And it should take them maybe 2 weeks, maybe not quite that long. The problem we have is we're also waiting on the parking lot to be done. And once the parking lot starts, everything else is gonna have to stop, because they're not gonna be able to drive down through there and get on the new asphalt. So it's kind of a juggling act right now of when things are gonna happen. Hopefully everything will work out, but the rain is hurting the asphalt installation. So hopefully we'll get it all worked out. We went ahead and put some tentative dates for when we're gonna move, and I did talk to Mr. Pig about this schedule, and again, it's very tentative because the things that are still up in the air. That schedule there is in front of you. I kind of have in my feeling that it may get pushed back another week. But we're gonna hold to this for right now, and we'll see that, I would think by a couple of weeks, we'll know for sure what's gonna happen on the progress. So, but we need to get a schedule out, so staff knew what is expected. One thing of this move that we're looking at closing this office for 3 days. Arnold would still operate the whole time, so we still would provide services to the community during those 3 days that were closed here. But really just to be able to logistically get the things from here to there and the least interruption, that's what our plan is. So if we can do that on a Monday, Tuesday, and a Wednesday, and then we would open on Thursday. And Melissa would have a half a day of clinic in the afternoon. So that they could use that morning for the nurses to walk through and make sure things working and then do a half a day. That would give us Friday, if we found some issues that needed to be fixed. We would have that Friday and all weekend be ready for the following Monday. So that's kind of the plan, but again, it's already been pushed back once and may happen again. But the building looks really, really good. You all took a tour of it. It looks really nice. It's just much better than what we have here. There are some things they need to fix, and they're working on it. So we hope to be in the building soon. I did put in the architect report, and the construction payments is in there like it always is as well. Any questions on the building?
Okay. Brings us to new business. Act on nominations for election of board officers. Anybody want to make a nomination?
Make a nomination that you continue as the board chair.
You let me get beat up?
I second that.
Yes, sir.
Okay, is there any other nominations? All in favor of nominating Tim Pig and putting him as chair or keeping him as chair, please say aye. Aye. Any opposed? Motion carries. Is there any nominations for vice chair?
I'll nominate Amber for vice chair, please.
Would I second it?
Thank you. Second.
Thank you that you said that. Is there any other nominations? Not hearing any, all in favor of Dr. Henry in as the vice chair, please say aye. Aye. Any opposed? Motion carries. I thought you might vote against it yourself.
Hoping not.
Is there any nominations for secretary treasurer?
Sure, I'll say. You're saying.
I'd like to nominate Tammy Sitter.
Okay, so we have a first and second. Is there any other nominations? Okay, not hearing any, all in favor, please say aye. Aye. Any opposed? Motion carries. Thank you for serving that. Okay, next on the agenda is approval of the 2025 Jefferson County Health Center budget first quarter revisions. It's part of what our audit said to do, right?
Yes, it
Thank you.
is.
All right.
We are following that. So the first quarter revision, you'll see approximately a $70,000 decrease in budget. And this is driven by contracts, being adjusted to actuals remaining as of 12/31/2024. Contracts that ended March 24th. The contracts that will not be renewing in July, which is just one. Title 10 supplemental funding that we received in March. New contracts and grants, the COSIP, and then we have got a small one from the City of Arnold Tourism Commission. The hourly rate increasing for legal, which Sykes already talked about. The new Hillsborough building utility expenses that are already incurring. And the new loan payment schedule for the new Hillsborough building.
I'm gonna ask the question, is there any, does this reflect anything on any of the services we provide? Is there any changes in that?
No.
Okay. Does anybody else have any other questions? Do you need approval for this, I suppose, correct?
Yes,
Yes.
yes, please.
What if they cut like more grants and contracts? What if it comes up that they just keep flashing things? We need like another revision?
So I'll do another revision quarterly, no matter what. So you get to see me every 3 months.
We didn't always, did we?
Nope,
Okay.
That was,
But
this
more.
is new.
that was part of the recommendations through the audit,
Okay,
when we get an audit.
Great.
You guys need to do that, so we're doing that.
okay.
Then I have a motion to approve the approval of the first quarter revisions as discussed by Ms. Fair.
Make the motion to approve.
Do I have a second?
Second.
Is there any discussion on the matter? Not hearing any, roll call vote, please.
Mr. Pig,
Yes.
Dr. Henry,
Yes.
Ms. Stone,
Yes.
Mr. Beal,
Yes.
and Ms. Taylor.
Yes.
All right. Thank you. Is there anything else?
Nope.
Okay, thank you very much. We have a resolution authorizing the Jefferson County Health Center to provide mosquito control services to the city of DeSoto, the city of Hillsborough, and the city of Kimmswick. There are actually 3 different documents, but they are all the same, just changing the city. I will do a first reading on this one. Can I have a motion, I guess, to accept or going through these contracts?
I'll make
First,
the motion.
do I have a second?
Second.
Okay, now I'll read it. Then we'll ask for if there's any questions. So I'm just gonna read the first. It's an intergovernmental cooperation agreement regarding the mitigation and abatement of mosquitoes. The agreement made and entered to this 22nd day of May, 2025. And between the city of Hillsborough or DeSoto or Kimmswick and the county of Jefferson and the Jefferson County Health Center. So that was the first paragraph. That's all I'm going to read. Is there any discussion points on this?
So you all are aware, these are the same.
Yes, they're all the same.
Contracts that we passed last year, there was no changes.
Yeah, no changes.
Recurring, basically, the recurring.
And all 3 are in one grouping. So is there any questions about it? Any,
Just so folks are aware, we can provide services in unincorporated areas of the county, but in incorporated areas, we need these
intergovernmental agreements.
to do that.
The only question I have is, could I get like a material that's printout of what's in that mosquito control? Like, we don't have DDT in those, do we?
No, we can get that though, we'll get that printed out, but no, we're not DDT.
Great, thank you.
Not hearing any other discussion points, I will call for roll call vote for the approval of the mosquito control services for the cities of DeSoto, Hillsborough, and Kimmswick.
Mr. Fig,
Yes.
Dr. Henry,
Yes.
Ms. Stidham,
Yes.
Mr. Deal,
Yes.
and Ms. Taylor. Yes.
All right, motion is approved. Next on the agenda is entertain topics for next agenda. It's limited to 3 topics required, second place on the next agenda. Does anybody have any items they wish to discuss at this point
The next agenda?
for the next agenda?
Yes, I would like to speak on the necessity of infectious disease control.
The necessity
Mhm.
of infectious disease control. Do I have a second for that?
Not sure what you're asking. Or,
Or speaking of
yes,
the fact that we need infectious control in health department and.
just the fact that we need it.
Yes, and why? Not just that we need it, but why? It's not a vaccination, it's just understanding why it's necessary in the community too.
Are you wanting someone to speak on that?
No, I was gonna speak as to why we
Oh,
do
okay.
that. Yeah. For all health boards, all communities. And schools, including schools.
I'll second that.
Okay. Yeah, Jeff, put that
Yes.
on the next agenda. Is there anything else? Okay. Next is closed session. I apologize, we do have to have a closed session. Would somebody make a motion to go into closed session?
Make a motion to go into closed session.
Seconded?
We have a first and second, this pursuant to, I'm sorry, you want to read that?
Well, I can't get to it right now.
Pursuant to
Yeah,
6
hard copy all the way.
610.0.021 confidential privileged communications between the board of trustees and Jersey County Health Department's representative and its attorney, 610.21, sections 1 and 14.
On
Is
also
there-
the section about evaluation and potential termination of personnel. That's not
Okay.
open, but we can go into it.
And personnel. Is there any discussion points on the matter? Roll call, please, Ms. Pinkley.
Mr. Fig,
Yes.
Dr. Henry,
Yes.
Ms. Stidham,
Yes.
Mr. Deal,
Yes.
Ms. Taylor.
Before we go, will there be anything that we'll have to report out on?
No.
Okay, so you can leave, there will not be any reporting out, so thank you, folks.